So yeah, thanks, John. So I'm going to, like John said, I'm going to talk to you about a bit of work that we did on behalf of the North West Primary Care Trusts, so back in last year now. And they were interested in climate change, and from their point of view, it's its impact upon health and on health inequalities here in the North West. And so before I sort of go and talk on about sort of what we did and how we did it, I'm sorry, I just realised there's a pretty awful picture I've got on there. It looks like something straight out of clip art. But never mind, I do have a better picture. I think it's got a bear on it on the next slide, so that's got to be better. So I just want to introduce sort of a bit about climate change, where some people might not be quite so sort of up on the issues. So yeah, there's the bear, and he's on a sort of melting sort of block of ice. So that's the sort of thing we always see when we talk about global warming, which is the rise in global temperature caused by the increase in what we call greenhouse gases in the Earth's atmosphere. And so this means that heat cannot escape our atmosphere as easily, so the whole planet becomes warmer, and we see things like melting ice caps. So what is this caused by? Well, this sort of evidence suggests, and it's generally accepted, this is due to sort of increases in human emissions of these greenhouse gases, particularly carbon dioxide. And so importantly for us, emissions are predicted to stay high throughout this century. You're probably aware of sort of international attempts to get agreements amongst governments in different countries to sort of reduce their level of emissions, but on the whole, these haven't been particularly successful. So yeah, so in terms of climate change, we can predict changes to climate based upon global warming and the level of greenhouse gas emissions. And so these are the sort of changes that we can expect to see throughout this century. Really, these things that are sort of starting now and then becoming more exaggerated or sort of more severe, if you like, throughout as the century goes on. So the sort of things we hear about are warmer year-round temperatures, so warmer winters and warmer summers, which sounds like a good thing. Changing rainfall patterns, so fortunately wetter winters, but drier summers, which, considering the weather we've had recently, certainly sounds like a positive thing, and that's all due to sort of changing wind currents. We can expect to see a sort of increased risk of longer and hotter heat waves. So the sort of heat waves we've seen in recent years becoming more frequently and sort of lasting a longer time, and sort of more hotter as well. So the sort of the impact upon death that John was speaking about minutes ago, it seems likely that would be sort of become more often and more severe. And increased risk of heavy rainfall events and storms, and so as a result of that, more sort of flooding, which we've obviously seen quite a lot of in Britain in the last sort of few weeks. So yeah, so onto this report, as I said, so it's a bit of work done on behalf of sort of an environment steering group as part of the North West Primary Care Trusts. And the work was aimed at empowering public health, environment and local government organisations to take action at a local level in response to climate change. So what we wanted to do, we wanted to obviously to understand how climate change is likely to impact upon health and health inequalities here in the North West, and to make recommendations on how to minimise the impact of climate change on health on a local level, so sort of to identify some perhaps sort of local priorities and how we can work towards to reduce these sort of health impacts. And to examine the evidence from a public health perspective and produce a report accessible to public health professionals. And what we mean by that is often climate change and health, the work is often presented very much from a climate change perspective. So we'll have sort of different climate change events and scenarios such as sort of flooding and drought and food shortages, and then they sort of list the aspects of health that are sort of associated with that. But we wanted to produce something that was, so for example, someone who had an interest in, say, cardiovascular diseases could look at specifically cardiovascular diseases and all the ways that's going to be affected by climate change. And so our report sort of we have different sections for different aspects of health, basically. And finally, to enable individuals and organisations to disseminate some information themselves. So what we did, we produced 3 different sets of slides that so people could kind of they're on an accompanying CD that came with the report and are also on our website. And people can sort of mix and match, really, take the slides that are most relevant to them and their organisations, and to use that to pass the information on. So how do we do the work? Well, it was informed through sort of 4 different sources. So firstly, through a review of the evidence, and this enabled us to really to fill the sort of the structure and the bulk of the report, really, in terms of what the impacts on health of climate change are likely to be. So we researched, I think, 10 different health and environmental databases for journal articles and reports and that sort of thing. And that's why, like I said, that helped us to identify really what the main impacts on health were going to be, and then we were able to go and sort of fill in the gaps through sort of further evidence searching. Throughout that bit of the report, we featured kind of case studies, sort of examples of organisations here in the Northwest who are deliberately or not, but reducing the impact of climate change through their work. So, for example, we found a skin cancer sort of mobile service, which was a van that travels around different locations in the Northwest and targets people who are perhaps at risk of getting skin cancer, which is one of the aspects of health we found was going to be perhaps an increased risk due to climate change. We also found like it's like a forum for people who'd experienced flooding to sort of help to reduce the psychological impact upon them. And in the second part of our report, we wanted to look at, as I said, sort of local priorities and recommendations for action on like a local level. So we had like a consultation really through a workshop which was in Manchester in April last year. And this was attended by, I think, about 40 to 50 people from different sort of health, local government and environmental organisations. And we presented them with different sort of climate change scenarios. So, for example, like food shortages and drought, heat waves. And we asked them to consider this from their sort of organisation's point of view and how they would be able, what sort of things they'd need to do in order to be able to tackle these scenarios, how they could be helped to reduce the impact of these scenarios. And and also we were informed by expert opinions, so we consulted with I think 5 or 6, I think 6 in the end, different sort of experts in this field, of which John was one, I think. And so we asked sort of similar questions really to around the workshop. How can public health professionals and other organisations be helped to minimise the impact of climate change? So moving on to the findings, and so what are the likely impacts on health? This was really what came out of the literature review, and in the report there's a great deal of detail about sort of each different aspect of health that we identified. I've sort of summarised them here, but I haven't got time to go into any detail. As I've said, there's much more detail in the report. But so these 8 different aspects of health that we identified as being particularly at increased risk due to climate change this century. So again, this is things that are starting perhaps to become more at risk now, but we'd expect that over the next sort of 80 years or so, as the climate changes, the risk to increase further. So yeah, I'll just quickly run through them. So we found there to be an increased risk of mental health conditions and poor mental well-being, respiratory diseases, including allergies, allergic reactions, skin cancer, thermal illnesses such as heat stroke, sunburn, cardiovascular diseases, gastrointestinal diseases, which is sort of through food poisoning or food contamination, water contamination, leading to sort of intestinal diseases such as diarrhea. Didn't put a picture of that one up there. But insect-borne diseases, which I've kind of queried because the evidence is a bit inconclusive really in the UK for what the effects of climate change is going to be. But worldwide, certainly there'll be sort of a shift in conditions that are perhaps conducive to insect populations such as mosquitoes or ticks. And so we'd expect that global patterns of diseases like malaria, Lyme disease and West Nile virus to sort of move as well. It's a bit unsure how that's going to affect the UK, but there's a chance that if our own weather gets sort of a lot warmer and perhaps wetter, then it'll be more conducive to perhaps mosquitoes, for example. And the other way this could happen is sort of through tourism. Tourists go into countries where these diseases haven't been present before but are now present, so they might be bringing them back into the country when they wouldn't be perhaps taking sort of precautions that you would, sort of like malaria tablets, if they would go into these countries now. And I mean, we might think that in the United Kingdom, quite an advanced healthcare system, that we wouldn't have too much, wouldn't see these diseases such as malaria having such an impact as they would in other countries. But the example of sort of the United States around the turn of the last century and still now, outbreaks of West Nile virus where there didn't used to be any at all. That sort of shows how these sort of epidemics can come about. And finally, reduced access to healthcare, which I'll discuss in a bit more detail, and I want to talk a bit about flooding. But really the idea that's due to extreme events, particularly in flooding, storms, we might expect access to healthcare to be particularly important, people getting injured and so on, but sort of damage to infrastructure, which can reduce people's access to healthcare. So that's obviously quite a few potential negatives, well, what we expect to see from climate change. But so are there any positives for health? Well, yeah, I mean, it's not something that we discussed too much in our report, but logically looking at the sort of changes we're expecting, you might expect there to be some positives. An obvious one, so in warmer winters, which we expect to see throughout this century, well, we know that when in very cold conditions, we see kind of increases in cases of respiratory conditions and cardiovascular conditions, particularly amongst elderly and vulnerable populations. But with warmer weather, you might expect to see less of that, so less cases of winter flu and cold-like conditions. And then a couple of benefits perhaps that are kind of indirectly associated with climate change, but might more reflect our sort of human behaviour really. So in the UK we're working to reduce our emissions, and there's increased sort of awareness about the need to be sort of environmentally friendly. So with reduced levels of air pollution in the UK, you might expect there to be reduced risk of the sort of cardiovascular respiratory conditions that are typically brought on by exposure to air pollution. Perhaps that will particularly benefit urban areas. And again, an increased focus on active travel. Again, this idea that we should be walking more and cycling more, perhaps as an alternative to using cars, or just to be more environmentally friendly. And so through increasing our physical activity in this way, you'd expect to have a whole range of health benefits. But for example, reducing obesity and diabetes, which we know are two of the sort of big issues at the moment. So extreme events due to climate change, it's probably the most sort of dramatic way that climate change can have an impact upon our health. As John said, I thought about talking about heat waves, but I figured it would be more apt to really talk about flooding at the moment, because worldwide examples of extreme events are likely to be things like drought and food shortages, and perhaps migration patterns due to people not wanting, needing to move out of areas that become very, very hot and so on. But in the UK, flooding and heat waves are kind of going to look to be quite sort of prominent features in the impact of climate change upon our health. If I go back a couple of slides, all of these aspects really fall into at least one, and quite often both of those of climate change and heat waves and flooding. In those cases, we'd expect to see most of these issues arise. In terms of flooding, obviously, there's been quite a lot in the UK in recent weeks. Haven't been too badly affected in the northwest, but I'm going to sort of frame this in a northwest example. I'm sure you remember the flooding in Cumbria, and I think it was November 2009, and that pictures of Cockermouth in the Lake District, which kind of got the worst of it, I think. And that's the sort of picture you typically see of sort of a flooded high street with like a lamppost poking out the top and cars sort of submerged. And that was in November 2009, and following a prolonged and very heavy rainfall, sort of days of heavy rainfall in the build-up to the flooding, and the day of the flooding themselves, I think it was sort of like a month's worth of flooding within just a few hours. And so this led to over 2,000 properties flooded, water levels reaching 2.5 metres. And then some of the impact this had, well, there's death of one policeman due to drowning. I think someone who was basically organising traffic and got caught up in the water movement. Forced relocation of key services such as police, doctors, surgeries. Relief centres and emergency services had to be established to sort of help people who've been forced out of their homes, and to host these services had to be moved. Destruction of roads, public-private rights of way and bridges, and reported psychological trauma amongst communities in sort of the months and even years afterwards, this negative impact upon mental well-being that's been seen. So that sort of shows the different ways that flooding can impact upon a community. And in the next 20 years then we expect more of this. So this is a quote from the UK Committee on Climate Change just last week. They say that 4 times as many homes and businesses could be at risk unless the UK prepares for more extreme weather conditions. And why is that? Well, they're saying it's because of increased building in floodplains. Actually, apparently, I think I read it at a higher rate than not in floodplains. And increased incidence of heavy rainfall events that we know to expect due to climate change. And so that means it's more likely to be more destructive floods that are going to be more frequent and are going to impact upon more people. And of course, there's sort of measures taken to reduce the risk of flooding, such as improving flood barriers and sort of flood defence systems. But the fact that the amount of flooding we've seen even so far this year, so it indicates that there's quite a way to go. So what are the main risks to health from flooding? Well, as we've mentioned already, drowning is obviously in the immediate aftermath of as the flooding is going on, and injury. Anytime when you're with fast-moving deep water, you're obviously putting yourself at risk. I think there's been at least 2 deaths in this year in the UK, people drowning during flooding in the south of England, 1 in April and 1 just last week. Anyone who's followed the news will have heard of the flash flooding in the south of Russia. I've got the name of the place written down, but I can't pronounce it. But which is after flash flooding there, and over 200 people reported to have drowned there, and another 200 at least apparently in hospital, injured still. So that sort of shows the really devastating impact that flooding can have. And so other sorts of risks to health, mental well-being, there's quite a lot of evidence about cases of post-traumatic stress disorder, depression, anxiety and stress after experiencing flooding, and particularly in people who've had to move out of their homes, or people worried about loss of material goods. They might have people with insurance concerns and general financial worries. So risk of increased cases of respiratory illnesses. Obviously, if you're having to wade through cold and wet water, then you're putting yourself at risk of catching cold-like conditions, and also having to go back to damp housing, so it increases the risk as well. And I've mentioned contaminated water supplies, and this isn't something perhaps that's going to be so much of an issue in Britain as in countries like Pakistan and Bangladesh, and we've seen where water supplies getting contaminated during flooding, leading to outbreaks of intestinal diseases. In Britain, we'd like to think that our water systems are a bit more developed, and that shouldn't happen. But there's certainly a risk. When I was in Cheltenham at the time of flooding in, I think it was 2007, and all our water systems were shut down for 2 weeks because they got contaminated by the floodwater. So we had the army bringing out water in tanks for at least, I think, for 10 days afterwards, which, I'll be honest, got pretty tiresome quite quickly. So what else in flooding? Well, this is this idea of access for healthcare being restricted during, particularly after flooding and storms. So you might expect there to be a higher demand for acute healthcare during flooding, but storms and flooding events can cause damage to infrastructure, such as we heard about in the case of Cumbria, to medical facilities and roads. Just a couple of pictures again of this is Cockermouth again. So you can see in the picture on the left of the bridge that's been broken, and on the right another sort of high street scene where it's underwater, a car desperately trying to somehow get down the middle of it. And this means that people are going to have reduced access to hospitals, doctors, and difficulty for emergency services accessing those in need. And also, so not just people who are perhaps got this acute health concerns, but people who perhaps rely on carers coming to visit them on a daily basis, or medication, having to access medication all the time, perhaps elderly people, disabled people. They're going to struggle to perhaps access that healthcare as well. So that's around the direct impacts on health of climate change. And so I'm going to talk a bit about what we call the what next chapter, is recommendations for actions on a local level. So we tried to, this is what came out of the consultation we held in Manchester, and also through talking with our experts. So we tried to come up with some priorities really for how organisations can hope to minimise the impact of climate change. So some questions that we came up were, so how equipped are emergency services, local government health professionals to identify vulnerable people in extreme events? How prepared is local infrastructure and services to deal with extreme events and disease outbreak? How can we better engage with the public about climate change? And how can the public be helped to prepare for climate change and extreme events? And so these are just some of the ideas that kind of came out of those workshops, and that we found perhaps in the literature about reducing the impacts of climate change on a local level. There's a few more I think we've kind of covered in the report, but these are just some of them. So for example, to establish early warning systems to communicate with at-risk groups. So the Met Office have an early warning for people with COPD who can register, and then if there's weather coming that's going to bring likely to bring on their COPD, or make it worse, then they'll get an automated telephone call from the Met Office who will give them advice about what precautions they need to take, and and how they can minimise their risk. And logically, that could be applied to quite a lot of these situations. So, for example, to heat waves, to look at the prevention of thermal injuries or food poisoning, which you see a kind of an increase of a couple of weeks after heat waves usually. Secondly, to ensure information sharing and coordination between key organisations such as the Emergency Service, local government, NHS. So to help these organisations be aware of who is at risk and who may need help in an emergency. There's really an idea who people who need access to certain information, making sure that they know where to get the information from and who's got it. I think in the workshop we held, it kind of was quite clear that lots of times people weren't aware of what information was available. We'd have one person, one organisation saying, well, if there was a flood, we'd need to know how to access this set of people, and that we haven't got information, then someone who would often be in the same building with them in the same organisation pipes up and said, oh, well, we've got that information in our place, but we can't give it to you because you don't have access to it. So it's just sort of ensuring that those barriers are really removed. And review local infrastructure vulnerability and backup. So quite straightforward really. So things like transport systems, buildings, communication systems and energy supplies, just making sure that it's prepared for all these different events, and if something does go wrong, then have you got backup to perhaps cope with that. Engage with and support individuals and community groups who are interested in climate change and who want to do something about it. So we're doing some work at the moment that's involving engaging with quite a lot of community groups, and it's clear that there's quite a passion amongst people to do sort of environmentally friendly work, and they are interested in climate change. So how can we engage with these people and help them achieve their aims? And then this sounds a bit of an abstract idea, but reframing climate change issues in a positive light to lead to increased public acceptability. So an example I touched upon it earlier, emphasising the co-benefits of health, of cycling or walking more. So there's an environmental thing to do, and also it'll improve your fitness, lead to weight loss. There's kind of a feeling, we feel, that people are a bit bored of, sort of fed up of being the negative aspects of climate change. I don't know if that's reflected by the amount of people here today, but maybe by reframing climate change in a more positive light and seeing how you can bring benefits to yourself, then that might help people re-engage. And just finally, a couple of slides, one's just to mention evaluation of this work that we're doing. So yeah, we're kind of a brief evaluation of the report of the sort of impact 6 months, 6 or 7 months now after publication. So that's going to be a 10-question electronic survey. It's going to go out to everyone who received the work. So the aim is to identify how the report has been used, to identify which elements of it were useful, to inform our own future work, and how we really report the findings of our work. So the sorts of things we're asking, which sections of the report do people find useful and relevant? Have they used the report? So how have they used the report? So have they read it, hopefully? Have they used the slides that we sent along with it? Have they perhaps used it to inform policy or sort of decision making within their organisation? Or if they've perhaps presented any sort of findings to management or colleagues? And then we're asking sort of, what type of report do they find useful? So this report was quite an evidence-filled report, so there's lots of detail in there. So we're interested to find out if perhaps that's what people want, or would they rather have sort of very brief evidence briefings or bullet points, sort of summary, would they like sort of an executive summary, that sort of thing. And yeah, finally, what topics in the report would they find more research useful, particularly sort of in relation to that sort of what next? So how can we help them achieve those sort of actions and recommendations that we've put in? Would they need more information on how to engage with the public better, or how to better communicate with the public or with other organisations, and that sort of thing? And yeah, that's the link to the report if anyone is interested in it, or you can email myself and I'll obviously send you one. Okay.
I thought before we move on to Melissa's presentation, if there are any particular questions around the methods Geoff was using in that and the research approach. I'd like to welcome Melissa Marselle. Melissa is working at the Institute of Energy and Sustainable Development in Montfort University in Leicester, but is actually almost a full-time resident here, but commutes to Leicester. So, but based in Liverpool, has worked at University of Liverpool, University of Salford, and different research projects. As I said before, is a psychology graduate, and is a field of environmental psychology.
Yes.
That partly you're doing your PhD on at the moment.
Yeah.
And I think it's a really interesting area. I think Geoff alluded to this rather neglected aspect of the environment, climate change and health, which is the mental health effects and psychological effects. And we're going to hear now about perhaps a more positive note about some research into well-being, mental health, resilience and walking groups.
Yes. So hello, and thank you for coming out here this evening and spending part of your night. So thank you. As John just said, I'm Melissa Marselle. I'm in my second year of my PhD at De Montfort University. I work specifically within the Institute of Energy and Sustainable Development. My two PhD supervisors who unfortunately couldn't be here today are Dr. Catherine Irvine from the Institute of Energy and Sustainable Development at De Montfort and Dr. Sarah Warber from the University of Michigan in America. Oh, sorry, I'm just going to segue back. So the talk's going to be discussing the well-being of outdoor walking groups, and hopefully by the end you should have a bit more information about whether or not there's any psychological benefit to lacing up your hiking boots. Now, the idea that the natural environment is beneficial for human well-being is not new. I think this is generally understood in our culture that being outdoors in the natural environment is quite beneficial. And this quote from Soren Kierkegaard, I think, highlights this. Every day I walk myself into a state of well-being and walk away from every illness. I have walked myself into my best thoughts and know of no thought so burdensome that one cannot walk away from it. But by sitting still, and the more one sits still, the closer one comes to feeling ill. Or, a bit more parsimoniously, I have two doctors, my left leg and my right. Now, I like these quotes because they highlight both the mental and physical benefits from walking outdoors. So that in and of itself makes researching the well-being of outdoor walking groups a rich area. But moreover, there's a big popularity of outdoor walking groups here in the UK. There are historical and legal documents that ensure access to the countryside. And when I first came to the UK about 9 years ago, I quickly learned that I needed to buy a pair of hiking boots if I wanted to socialize with anybody, because the way people in Britain like to socialize typically is to go outdoors for a walk with one another. And for these reasons, investigating outdoor walking groups is quite a nice area to be in. But for a bit more context, the World Health Organization expects physical and mental health to decrease in the future. Currently, according to the World Health Organization, cardiovascular disease is the #1 cause of ill health. I'm talking to a bunch of people who work in the area of mental health, so you already know this. In Europe, cardiovascular disease accounts for just over half of all deaths, and the World Health Organization expects this trend to continue. In addition, the World Health Organization expects depression to be the second largest cause of ill health by 2020. So less than 10 years, depression will be the second largest cause of ill health. And this comes at a time where our government is becoming increasingly more interested in mental health and mental well-being. In their 2011 policy document on, their mental health strategy document, No Health Without Mental Health, the first objective was that more people will have good mental health. This is in direct contradiction to the World Health Organization and their predictions that more people will have poor mental health in the future. The objective is basically that more people have better mental well-being and good mental health, and fewer people will develop mental health problems. And in the report, the government acknowledges that access to green space is associated with better mental health. Now, how does the natural environment influence our mental health? Is it just a bunch of tree hugging and meditation, Well, it could be, but I'm going to discuss to you two actual theories of how the natural environment influences our mental health. The first is the attention restoration theory by Rachel and Stephen Kaplan, and the second is Roger Ulrich's psychophysiological model. The attention restoration theory states that the natural environment restores our ability to direct attention. Our ability to direct attention or concentrate requires mental effort. It requires cognitive effort, because in order to concentrate on work or a hobby, you need to inhibit any outside distracting stimuli, and to do that requires effort. And because our ability to direct attention requires effort, it can become fatigued like anything. And once it's fatigued, it just needs a rest. We're unable to concentrate or focus once we've depleted our directed attention, and so the only way to get it back is just to give it a rest. And natural environments are a great place to do that. By being in the natural environment, it allows for the rest and recovery of directed attention, so you top up your directed attention. But moreover, it gives you a higher order cognitive benefit, which is the clearing the head. By spending time in nature, you get this opportunity to clear your head, to think about life problems or to think about professional problems. And it goes back to that quote by Soren Kierkegaard where he says that he walks into his best thoughts. This is what this theory is talking about. The second theory is Roger Ulrich's psychophysiological model, which states that the natural environment reduces stress and improves emotion. That being in nature restores us from the physiological effects of stress. The physiological effects of stress are increased blood pressure, heart rate, and cortisol, which is a stress hormone. But by being in nature, one lowers their blood pressure, heart rate, and cortisol, and in addition, increases their positive emotions and reduces their negative emotions. Now this is restorative effect. So this is, you're already experiencing the physiological effects of stress, but by being in nature, you get reduced effects and increased emotions. Furthermore, there's a sort of preventative effect of being in nature, that if you spend time in nature and then you encounter anything stressful, you're going to react less to it, is what this says. Okay. So my PhD is entitled Growing Resilience Through Interaction with Nature. The acronym is GRIN. I'm American, we love acronyms and what they mean. Generally, the PhD is investigating the mental and emotional well-being of people who do and do not participate in an outdoor walking group. So that's what it is generally. And it's looking at a specific outdoor walking group, which is Walking for Health. Walking for Health is currently managed by the Ramblers Association and Macmillan Cancer Support. It was previously managed by Natural England and the Department for Health, and it was through Natural England that I was able to get access to participants because they really championed and helped the study. But it's been moved on to the Ramblers and Macmillan Cancer Support now. Walking for Health was developed by an English GP. It was aimed at people who do not take much exercise. I think the GP found that a lot of people coming into his office who had cardiovascular issues with obesity, also had issues with physical inactivity, and he was just trying to link all these things up. So Walking for Health provides free group walks led by 2 trained walk leaders. In this photo, the walk leaders are the people wearing the high-vis vests. Walking for Health only operates in England. In Liverpool, I know that there are at least 3 health walks. There's one in Liverpool 1, another at the docks, and a third at Sefton Park. And Walking for Health is one of the largest public health interventions for physical activity in the UK. So it's a great opportunity for investigating or evaluating the mental health impacts that this program has. Like I said, I'm in my 2nd year of my PhD, and I have a lot of research questions that I'm investigating, but for the purposes of our talk today, I'm only going to focus on 2, okay? And then hopefully give you some data to answer these 2 questions. So the first is just generally, do people who participate in Walking for Health have better mental and emotional well-being than individuals who do not participate in Walking for Health? And the second is, does mental and emotional well-being vary by the type of environment one is walking in with the walking group? So the study is a longitudinal, non-equivalent control groups design, and both groups of participants were participated by taking 2 online questionnaires. The first questionnaire was baseline, and then they took their second questionnaire 13 weeks later. And the 2 groups of participants are active walkers. These are people who attended at least one Walking for Health walk between the 14th of January and the 14th of July in 2011, and a comparison group comprised of individuals who had not taken part in Walking for Health between that time. Data collection started in August 2011 and it ended in January 2012. And there are 1,931 participants in the active walker group and 1,390 participants at baseline for the comparison group. So that's over 3,000 participants for baseline. This table shows you the demographics of both groups, the percentage of individuals who are aged 55 and over, who are women, who are of a white ethnicity, who are partnered, either married or cohabitating as a couple, the percentage of individuals in each group who have a disability, who have at least one or more medical conditions, and who are university educated. I then ran a chi-square analysis, a statistical analysis to determine if the 2 groups were significantly different on any of these demographic variables, and they were significantly different on all of them except for university degree. However, the effect size of all the significant chi-squares are negligible. They're less than weak. So there is a very negligible, no association to the significant results of gender, ethnicity, marital status, disability, and medical condition. So the groups significantly differed on their age, and that has a moderate association in the effect size there. So the comparison group was comprised of people that were a bit younger than the active walkers group. And both groups did those 2 questionnaires, and it was a really long questionnaire, so everybody was actually pretty awesome for doing it. And it had a battery of scales and measures in it, because I wanted to assess different aspects of well-being. So I asked questions about mental well-being, social well-being, emotional well-being, and also people's connection to the natural environment. I had 5 dependent variables, and those are from mental well-being, psychological well-being, depression, and perceived stress, and from emotional well-being, positive and negative affect. In addition, the questionnaire included 3 covariates, which are psychological resiliency, social support, and connection to nature. These covariates were included because they could be things that would influence those dependent variables. So to answer the first research question on whether or not people who take part in Walking for Health have better mental and emotional well-being than individuals that don't, I conducted an independent samples t-test at the baseline data. This graph here shows you on the left-hand side, you have all of the variables that were tested. The first 5 are the dependent variables, and then the last 3 are the covariates. And then the bars show you the mean scores of active walkers in blue and the comparison group in green. Now, the 2 groups significantly differed on the 5 measures of mental and emotional well-being that people who were defined as active walkers and Walking for Health had significantly better mental well-being and positive affect, and significantly less depression, negative affect, and perceived stress than the comparison group. Moreover, the 2 groups did not significantly differ on the covariates of psychological resiliency, social support, and connectedness to nature. The same analysis was then repeated at the follow-up data, And again, the results were almost the same. There was a significant difference in the mean scores of the 5 measures of mental and emotional well-being, in that the active walkers had better mental and emotional well-being than the comparison group. But there was one slight difference. At follow-up, the 2 groups now differed on psychological resiliency, with the active walkers demonstrating better psychological resiliency at follow-up than the comparison group. This is quite interesting because the measure is supposed to be, it's considered to be stable. It's about the personality characteristics within oneself and how they deal with stress. So I need to investigate why this changed. Perhaps there's some issue with the scale, perhaps. But furthermore, there was no significant difference between the 2 groups on the mean scores of social support and connectedness to nature. So that answers the first research question of, do people who participate in Walking for Health have better mental and emotional well-being than those who don't? To answer the second research question, which is, I'm going to get the wording correct here, does mental and emotional well-being vary by the type of environment one walks in? I did a hierarchical multiple regression. Now this regression investigated whether the type of environment walked in with a Walking for Health group would predict mental and emotional well-being at follow-up, whilst controlling for mental and emotional well-being at baseline. And so what this meant was that on the follow-up study, individuals who were in active walkers, I asked, in the last 13 weeks, have you taken part in a Walking for Health walk? If they said yes, I then asked this question: what was the main type of environment you walked in with this group? And then participants had to choose one of these 9 environments, or they could choose to write in an option. So then that was entered into a hierarchical multiple regression for each of the 5 dependent variables. So 5 different regressions were then run. This shows you the results from the regression. And first of all, it shows that the regression was significant, that the inclusion of adding the type of environment walked in made a contribution to the prediction of mental well-being at follow-up. The first column shows you the different variables. T1 mental well-being is mental well-being at baseline, and then all the different types of environments walked in with a Walking for Health group. And then the column that's B are the regression weights, and then the p-values are how significant those regression weights are. So just making it easy for you, I've highlighted the ones that are significant. And those are individuals who walked in a natural place with their Walking for Health walk, who walked in a green corridor environment with their Walking for Health walk, and walked in a farmland environment with their Walking for Health walk, and then the miscellaneous other. And what this means is that by walking in each of these environments, individuals increased their mental well-being at follow-up by a certain amount. And that these 3 environment types are significantly significant, if you will, predictors of mental well-being. But not only that, these 3 environment types were significant predictors of all 5 dependent variables. That walking in a natural place, a green corridor, and farmland environment with your Walking for Health walk significantly contributed to an increase in mental well-being, an increase in positive affect, and a decrease in negative affect, depression, and perceived stress. So in summary, the findings demonstrate the value that organized group walks can have for mental and emotional well-being. We saw that individuals who take part in Walking for Health had significantly better mental and emotional well-being than individuals who did not. And that the type of environment that one walks in with their walking group can influence mental and emotional well-being. That group walks in natural places, green corridor, and farmland environments significantly affect mental and emotional well-being. And that the results suggest that the green space group walks may possibly be a cost-effective way to improve mental and emotional well-being. And I thank you for your time.